How can you know you are having hormonal imbalance? This is the question that a lot of women keep asking every now and then. They want to know how to check themselves to know if they are having hormonal imbalance. And as a matter of fact, a lot of women are having hormonal imbalance without them even knowing. But in this video, I'm going to be explaining to you the major 7 signs you can see in yourself to know you are having hormonal imbalance at early stage. In fact, some women might be having this condition and it's only when they get married that they will even notice they're having hormonal imbalance. But as a matter of fact, hormonal imbalance is what starts affecting you. It gives you signs before it even finally affects you. And that's what we're going to be looking at in this particular video. Now, one of the major ways as a woman to know if you're having hormonal imbalance is if you're having changes in your menstrual cycle length, in your menstrual cycle flow. Let me give you an example. If your cycle used to be 28 days, it used to be 30 days, it should be 22 days, and all of a sudden it now changes to 22 days, now changes to 25 days cycle, it now changes to 30 days, 35 days, 37 days, 40 days cycle, you should know you are having hormonal imbalance, because hormones are the things that controls your menstrual cycle. If your menstrual flow used to be 3 days, all of a sudden it now changes to 4 days, all of a sudden it now changes to 5 days. Your flow is not coming out for 5 days, it's not coming out for 7 days, it's not coming out for just 1 day. You should know you are having hormonal imbalance, because hormones are the things that also controls your menstrual flow. Now, if you're kind of person that do notice your ovulation, as a woman, you notice discharge that looks like egg white, you notice pains in your nipple, you notice a kind of lower abdominal pain either at the left side or the right side when you are ovulating, you notice your libido increases, you want to meet your partner when you are ovulating, and all of a sudden you don't longer experience all these signs as a woman, you should know you are being welcomed by what we call hormonal imbalance. And what can you do as a woman? You are to visit a gynecologist to manage this condition. They will check your hormones to know which particular hormone is having problem, because all these hormones, there are so many hormones that controls all of these things. So they need to know the particular hormone that is having problem, if it's estrogen, if it's luteinizing hormone, if it's follicle stimulating hormone, and they will give you medication that will manage that particular hormonal imbalance you are having. But the mistake that a lot of women do is taking medication anyhow. They keep taking CoQ10, inositol, and so many of them. But these medications cannot just help you like that. You need to make sure you are taking the medication for that particular hormone that is having problem. Now, one of the other ways as a woman to know if you are having hormonal imbalance is if you are always dry. When your partner is close to you, when your husband is close to you, you don't longer get wet. You're a kind of person that do get wet by just seeing your husband, and all of a sudden you're no longer getting wet, and your husband might think you don't love him again. It's not because you don't love him again, it's because you're having hormonal imbalance. And there are medications you can take to help this. If you're having low level of estrogen, you will not get wet. As a woman, if they romance you from now to next year, you will never get wet because you're having low level of estrogen. And there are medications that can boost this level of estrogen. As a woman, if you are noticing breast milk dropping from your nipple when you're not pregnant, you're not breastfeeding, you are just having breast milk coming out from your nipple, when your partner sucks your breast, or when you press your breast, you notice water coming out, you notice fluid coming out, and you think you are healthy, you are not healthy. It's because you're having hormonal imbalance. And this can be high level of prolactin, which mostly happens to people that have polycystic ovarian syndrome. But there are medications that can manage this as well. As a woman, if you're always having mood swing, you just don't want to talk to anybody, you want to be alone, you're always irritated, you don't want people to come close to you, you want to be isolated. Some people will say they are introverts. You are not an introvert. It's because you are having hormonal imbalance, because this condition happens due to hormones. Your mood is being controlled by hormones. So once you are not having mood swing for an unexplained reason, you don't know why you are having mood swing, you are not happy, you don't want to be close to people, you should know you are having hormonal imbalance. And these are things you can manage at early stage. Don't ignore them thinking they are normal daily things that happens to you. No, they are hormonal imbalance. And I hope this video helps you as I've always wanted. So if you find this video very helpful, please do well to subscribe to my YouTube channel, and don't forget to share this video to as many people as you can. And if you have your questions you want to ask about this particular topic, please do well to drop it in the comment section so I can be ready to respond to you as soon as possible. In my next video, I'm going to be explaining to you the different hormones that can affect your body, the different hormones that might be imbalanced in your system, and how you can manage these hormones accordingly in your system as a woman. I'll also be explaining the different ways a man can know he's having hormonal imbalance. Yes, because it's not only women that suffer from hormonal imbalance, even men can suffer from hormonal imbalance.